Thank you so much for joining us. My name is Greg Moss with Intermountain Health, and welcome to a very special edition of our Community Patient Education Program. We are broadcasting to you live today from the lobby of St. Joseph Hospital as we focus on Heart Health Month and taking good care of your heart. And this is the best place to do it because let me tell you something, the cardiovascular program here at St. Joe's is top ranked in the country, and we are so blessed and lucky to have the leader of our cardiovascular programs here in this region. Dr. Rusha Kahusa is joining us this morning, and thank you so much.
It's so nice to be here.
You are amazing. Your team is amazing.
Thank you.
So I'm looking forward to getting some more insights, but we're going to start with an easy question.
Sure.
How do I know if I'm at risk for a heart condition or a heart challenge?
Great question, Greg. So we've really asked that our population looks at their risk factors for heart disease. Classic risk factors: high blood pressure, high cholesterol, diabetes, big one, family history coming up more and more in our trials nowadays, smoking, weight, etc. And talk to your doctor about being proactive and getting screened for these risk factors going forward.
Talk about some of the specific signs. I'll share a little bit. I've had a series of strokes, very minor, had some heart challenges as well. I got to tell you, I kind of ignored everything.
Yeah.
Is that pretty typical?
It can be, and we especially feel that our women are specifically at risk for not really taking those early signs seriously. They're so used to being caretakers of others. We want them to be aware of their own risks and listen to their heart in terms of their signs. So some of the classic signs are with exercise, with activity, chest pain, shortness of breath, fatigue, not being able to do their activities in general. And then of course there's acute stuff such as heart attacks and strokes that can be a sudden change in your normal being that you need to be aware of and react to.
Bottom line is, if you feel something's off, it's probably off, so get some help. Talk a little bit about some of the amazing work you're doing here at St. Joe's. And I'm on the home team, so you would expect me to say this, but you are truly doing cutting edge treatments here at St. Joseph.
Absolutely, so much to be proud of. So the only 3 out of 3 star surgical program for open heart surgery in 3 states. So something that we're so extremely proud of. The outcomes here are fantastic. Our structural heart program that offers valve procedures without open heart technique are fantastic. They're really state-of-the-art, using technology, using data to really guide treatment for patients that are high risk for surgery. Watchmans that offer an alternative for blood thinners. Being proactive, really seeking care like you, not ignoring your signs and symptoms, and getting coronary calcium CTs without even needing a physician's orders to be proactive in your care and assessing your risk.
I want to go back to something you mentioned at the very top, which was valve procedures without open heart.
Correct.
Now, you may not think that's a big deal, but this is a minimally invasive procedure that used to would require, forgive my bluntness, you're cracking open the heart, and this is a major thing.
Yeah.
It is so much, I don't want to say easier, but much easier on the patient.
Absolutely. The recovery is so much quicker, and we're being able to offer valve procedures to patients who may not be able to get open heart surgery because they're too high risk. So both ways, really a win.
So how do I find out more information about what you're offering here at St. Joseph Hospital and really through all of our cardiovascular programs throughout the Front Range?
It's important for us to provide healthcare equity. It's important for us to have that easy button for our patients. We don't want patients waiting on the phone for 20 minutes to be able to get access to care. So we have a number, 303-272-0500.
Awesome.
Single number, you call into our clinic, you generally get an answer within 20 seconds, an appointment within 2 minutes. Something we really strive for every day.
That's almost as good as Jimmy John's. Freaky fast, let me just tell you, but really high quality and something very important. Anything else you want to say about Wear Red Day especially?
Oh, be aware of your risk for heart disease, your mom's risk for heart disease, your sister, your kids, everybody. Really watch out. Heart disease is the #1 killer, and we just need more awareness of it, and we need early treatment for it.
Thanks for helping us spread the word today.
My
Dr.
pleasure.
Rusha Kahusa, amazing. And one of many amazing physicians that we have on our cardiology team. In fact, St. Joseph Hospital is doing great work, but some of our other hospitals are as well. Let's take a look at a video from Lutheran Hospital.
to have this large facility within our community here in Wheat Ridge. We're really serving a population on the west side of town. We're one of the largest cardiology groups. And now with our new facilities, we have state-of-the-art technology to support our cardiac services.
We have the ability to, see a patient in the office and diagnose them with any cardiac issue, and then move them through the testing process from a non-invasive testing to more invasive testing to ultimate interventional procedures if need be, whether it be cardiac catheterization, heart surgery, electrophysiology procedures, anything you can think of. We're really a sort of a one-stop shop, full scope practice for cardiology.
Where patients would previously have to see a cardiothoracic surgeon for potentially open heart surgeries, now we're able to provide minimally invasive procedures.
I think it's really reassuring to our patients to know that they're continuing to get the great care that we've always given them now in this brand new facility.
Lutheran Hospital Here for Life. We are once again celebrating Heart Health Month and your life and helping keep you heart healthy here at St. Joseph Hospital. Dr. Tony Green-Cheatwood is our Associate Chief Medical Officer here in Colorado and is joining us now. It's good to see you as always.
You as well, Greg.
Let's talk about some of the risk factors. Dr. Husa just joined us a few minutes ago, but what are some of the more specific risk factors we need to really pay attention to keep our heart healthy?
Absolutely, and it's a good timing. I just left my cardiologist appointment this morning.
Wow.
And we reviewed my risk factors. Family history, big one. Smoking, that has been shown to have all kinds of negative effects on your life. Heart is one of the areas as well. Blood pressure being elevated, high cholesterol, and another thing called metabolic syndrome that we're seeing more of. Metabolic syndrome is a situation in which a patient has 3 of 5 conditions: high blood pressure, high waist circumference, so little thick in the middle.
Yeah,
that's right, sit up nice and tall.
Yes, thank you, suck it in.
High fasting blood sugar or glucose level.
Okay.
High cholesterol, specifically triglycerides, and then low what's called HDL, your good cholesterol. So when 3 of those 5 are present, we have what's called metabolic syndrome, and that can increase your risk for heart disease.
And we talked a little bit earlier about family history. That is a big factor as well.
That is a big factor. There are a lot of things that you get from your parents, hair color, eye color, and sometimes they're bad genes.
Yeah.
Things like hypercholesterolemia can be familial, meaning it's spread through the genes from parent to child.
Okay. The screenings that are available today are really important, and
Yes.
it's important to get them done on a regular consistency. Talk about the screenings and then how frequently I should get them.
Yeah, blood pressure check is one of the most important things you can do. You can have that at your regular primary care visit. Most pharmacies have a blood pressure machine, not always calibrated great, but good place to get that checked. Home machines are wonderful if you have a concern, checking your blood pressure pretty regularly. Getting your labs checked on an annual basis, your glucose again, your sugars, all those areas. The nice thing about those screenings is that when it's identified, we have things to treat them, such as medication, that can help keep your heart disease at bay.
And these medications that are on the market today, the side effects are much less than perhaps 5-10 years ago. So we should be afraid to have those conversations.
That's right. It's not only the side effects less, we have more options,
Yeah.
more different types of medications that work differently. So if one's not working for you, you don't have to abandon taking care of your blood pressure. We can try different medication, or sometimes 2 medications at low doses to combat it 2 different ways.
And it's really important to do that because we're trying to, elongate the game here.
That's right.
Give you more chance to get healed and better shape or whatever it might be.
Absolutely.
It all starts though with a conversation with your primary care physician most of the time.
It sure does. Having that primary care physician and that honest conversation about when your blood pressure is elevated. A lot of folks, me included, I'll take care of it. I'll just exercise a little more. I'll lay off the sweets a little more. I am on medication and it's helped my blood pressure immensely, and I consider that to be a preventative tool I'm using to prevent heart disease in the future. My mom had a heart bypass surgery at age 55.
Wow.
So it's very important to me to make sure I'm maintaining my blood pressure and my cholesterol and whatnot.
And keep those stress levels down.
Keep those stress levels down.
I'm not stressing you out as much.
No, you're not stressing me out. But the other part of that primary care conversation is really having that discussion about if you have a little bit thick in the middle, higher weight, being open and saying, what can I do to improve my diet?
Yeah.
Some people don't know how to improve their diet. Understanding what their options are in that space, what a healthy activity level looks like, and really understand how you can advocate for yourself.
And just a little bit of improvement can go a long way.
Absolutely.
One of the things, that easy kind of low-hanging fruit as we talk about to help you keep a healthier heart is to quit smoking.
That's right.
Just do it.
Just do it.
And there are many programs to help support you with that.
There's many programs to help support that, and the benefits of quitting smoking are literally instant. Within 20 minutes of that last drag, your heart rate comes down, your blood pressure can come down. Within the first year, your lung function is much, much better. Your carbon monoxide level gets to be a normal space. Within 3 to 6 years of quitting smoking, your heart disease that had been increased is cut in half.
Wow.
And after you've been smoke-free for 15 years, you have the same heart disease risk as a non-smoker.
So many things we can do as an individual.
Yes.
It's really important that we empower ourselves and take responsibility.
Absolutely.
No blame or shame. But
No blame or shame.
let's get in the game, people.
Responsibility.
That's what I'm
That's right.
saying. Well, good to see you.
You as well.
Thanks for sharing some tips here. We appreciate it. Dr. Tony Green-Cheatwood joining us. And let's meet a few of our other dedicated physicians who are specializing in healthy hearts here at Intermountain Health.
You know, we all in some way get to choose our path in life. For me, I wanted to make people better. When we cross paths on what might seem like your worst day, know that I'm on a mission to guarantee that your best days are still ahead. At the Intermountain Health, Heart, and Vascular Denver Clinic, these moments define us. Our team excels like no other because we are more than healthcare providers. We are your partner in health.
We have some absolutely amazing caregivers here at Intermountain Health. One of them is joining me now as well, Inez Smith, who's a registered nurse here at St. Joe's. You work in the cardiac rehab program.
Yes.
Tell me a little bit about what you do.
So cardiac rehab is a medically supervised education exercise program for a wide range of cardiovascular patients.
And what conditions do your patients have? Why do they come see you?
Most of the time, these patients have had a heart attack. They've had open heart surgery, either for bypass surgery or valve replacements. The catheter-based procedures that Dr. Husa talked about, those patients qualify also. And then heart failure patients do too.
So this rehabilitation, I mean, a lot of times we have physical rehab after surgeries and things of that nature, but it's especially important if you're having some sort of heart problem, because the benefits are great.
Yes. So a lot of these patients are, they feel loss of control over their health after these events. And so what rehab does is really, it gives them control back and helps them understand what they need. We work on their physical activity. We work on education around nutrition, stopping smoking, how do you control stress, all these things that can impact their health.
And you must be inspired by when a patient comes in feeling a little like they don't have any control, maybe a little bit down with what they're dealing with. And on the other side of this, how do they come out?
It's really amazing. And in fact, I'll share, we had a patient that had a valve replacement maybe a couple months ago, and he came into rehab last week, and he looked like he was back where he wanted to be. And so really seeing that progression, because we see a lot of these patients in the hospital and help walk the open heart surgery patients, we educate the heart attack patients, and to see them get control of their life back, give them confidence, it's great.
Well, thanks for the role you play in that and your team plays in that as well, because at the end of the day, it really is about treating the whole person, isn't it?
It is, it really is. And I think we look at all those things. We look at all those risk factors. We treat their emotional state too, because a lot of times that really can affect them. And so it is all of that put together to help them achieve what they want to achieve.
Now, as much as we love you and your team, we would prefer not to have to see you and your team.
Exactly.
So we want to keep you out of the hospital, just to be really frank.
Yes.
And people, as we've been talking about all morning here, you can be empowered to stay out of the hospital with these kind of challenges.
Yeah, just like what the doctors were talking about. Know those risk factors, follow up on them, get your family involved. If this is a familial thing, really stressing to them how important it is to follow up on that.
You love what you do.
I do, I really do.
I can tell. Patients are pretty cool.
Yes.
And they have great outcomes thanks to you. And again, your team too. Inez, thanks so much for joining us.
Thank you.
We sure appreciate it. Inez Smith here, registered nurse at St. Joe's. And we want to take a look now at our heart health program, specifically how we're dealing and treating women who have a health challenge. Let's take a look.
Heart disease is the #1 killer of women in the United States, yet women are underdiagnosed and undertreated. Nationally, disparities in cardiovascular care are stark. Women face higher rates of heart disease, lower preventative care, and worse mental health outcomes, all compounded by racial inequities. At Intermountain Health, with a 7-state reach, including 34 hospitals, 385 clinics, and 50 years of trusted care, we are committed to addressing these disparities. We're currently rated the top health system in the nation by Fortune. We've already made significant strides, reducing the time to diagnosing heart attacks with an EKG in women by 50%, improving mental health screenings, and cutting preterm births by 16%, along with developing an obstetric high blood pressure pathway. And we know there's more work to do. Now we're answering a national call to action by launching a women's heart and vascular program. With expanded digital tools, automation, and targeted interventions, we aim to change the future of women's health. We're uniquely positioned for impact with our reach, our reputation, and our community partnerships. Together, we can close these gaps and ensure that every woman gets the care she deserves. Thank you for the opportunity to make this vision a reality.
And joining me now is Stephanie Clark with the American Heart Association, or AHA as we like to call you. Stephanie, thanks for joining us.
Thank you for
It's exciting to have you here today. We are actually hosting a heart health fair at St. Joseph Hospital and at St. Mary's in Grand Junction simultaneously. We've got some video to show you what the heart health fair looks like here today. We're giving some CPR demonstrations, all sorts of educational opportunities. This is really kind of important and what you lean into at AHA too, right?
Correct, Greg. Our mission is to be a relentless force for a world of longer, healthier lives, and really it is about educating and creating that awareness around heart disease and stroke. Heart disease being the #1 cause of death globally, and stroke #2. So we really want to make sure we're creating that education and awareness out in the community.
Getting your blood pressure checked, awfully important, and we're helping people learn how to do that either at a medical facility or at home as well today. And there's something else I'm going to show you here in just a minute as we kind of pan around there. This is my favorite. This is the smoothie bike. We're going to make some healthy smoothies. So as soon as we're done, I'll go buy you a smoothie.
Love it.
That's right. It's all about diet. It's about education. It's about preventative options that you lean into at the AHA, but also science. You guys are really dedicated to the science portion of this.
Correct, Greg. Right now, we are funding actually over 50 different research projects here in the state of Colorado. So we are really fortunate to have researchers apply for our grants, and they receive those funds from the American Heart Association. And we also have our scientific sessions annually, where our researchers go and present their science that they've made possible, and so we are really excited to be able to have researchers and physicians come to those scientific sessions each year and really the latest cutting edge research that they're sharing with the world.
Well, you're making a big difference in that area, and I know a lot of our Intermountain Health docs participate in some of your research, both here in this region but also in the Salt Lake area in Utah. What other ways are you making an impact? Because there's a lot of other fun things people can participate in.
Yes, there are. And so, a couple things that we do locally is we have our Kids Heart Challenge program, where we are really making sure that at a young age, kids are learning about how to live a healthy lifestyle. And then they're able to take that information home to their families. They're learning about eating healthy. They're also learning hands-only CPR, which is really important, and a big initiative of ours here locally as well, to ensure that at least one person in every household knows how to do hands-only CPR. And so they're able to take that home to their families as well.
You got a heart walk coming up too?
We do have a heart walk, and we're so excited to have Intermountain Health there doing blood pressure screenings, which are really in blood pressure awareness at that event. So that is one of the risk factors that's been mentioned here earlier today, so we're excited to be having you guys
Not
there.
this year, Stephanie, but next year we are going to set a world record for blood pressure checks, aren't we?
Yes, we are.
That's what I'm
We
saying.
can do it.
We have a great partnership with the AHA kicking off actually today.
Correct.
Talk more about that.
Yes, so we are so fortunate and grateful for your support here at Intermountain Health. You guys are our Live Fierce, Reduce Your Risk sponsor. And today, kicking off the campaign that we're launching is called Cherish Your Heartbeat. And it really is what the doctor spoke about earlier. It's everyone being encouraged to get those numbers, to learn what your blood pressure, cholesterol, your blood sugar is, so that you can create that treatment plan with your provider. And so we are encouraging people to go out and learn their numbers, and so that you can take care of your own heart, so then you're there for your family as well. So it's a big message that we're trying to get out there.
So it's not just about one day.
Nope.
For us in our partnership, it's a year-long opportunity, and we really appreciate it. Where can people go to find out more information about the programs you offer?
Yeah, so you can go to heart.org to learn more about the American Heart Association and our programs. We have a lot of great resources, again, on the risk factors that we were mentioned earlier, and lots of different resources and initiatives that you can get involved with.
Great to have you here.
Yeah, thank
we're grateful
you so
for the
much.
partnership. Stephanie, always good to see you. And we're grateful that you joined us here today as well. We have lots of information to help you with heart health and other health challenges as well on our website at intermountainhealth.org. Please check those out. Check our social media channels as well for lots of updates and special events and opportunities. But again, thank you for joining us today.